Welcome back. COVID, the flu, and RSV are making their rounds once again. Odds are you probably know someone with a cough or sniffle, or maybe they're on the mend. The viruses show no signs of slowing, and it doesn't help that the majority of folks aren't getting the vaccines to prevent them. Science and health correspondent Lindsay Thies has more.
Now, these different respiratory illnesses that are circulating, this is really the season for it. It's not a surprise for public health experts, and your risk is going to depend on your own personal health and vaccination status.
Didn't think that I was going to test positive, but that was the biggest shock of the whole thing.
Sarah Fryman recently got COVID for a second time. She joined thousands of others in the surge of respiratory cases, including COVID-19, the flu, or RSV across the country. The bugs are more common this time of year.
Somebody walked in for a COVID test, and I'm like, oh my God, it's a positive. We had to look. I'm like, we haven't seen that in like 6-7 months.
As we enter the winter months, people are spending more time indoors, and we tend to see an increase in respiratory infections.
The CDC's latest data shows as of December 29th, respiratory illness activity was high or very high in 2/3 of the United States, stretching from New Hampshire to Washington state. Holiday travel is also a factor in the spread.
What happens in Thanksgiving and Christmas and New Year's is that when people get together, you mix the risk from one part of the country to the next.
Vaccines can keep someone who is sick from getting a severe case or dying, but CDC data shows only about 40% of adults and children have gotten this year's flu shot, and less than 20% have gotten the latest COVID vaccine. Experts say it's still not too late to get vaccinated and to watch out for symptoms like fever, cold, and cough. And if you do get sick, they say to stay at home and call your doctor in case there's medicine you could take to help speed up your recovery. Lindsay Thies, Scripps News, San Francisco.
Here now to share some practical advice on what you can do to get through this triple threat of viruses. Let's bring in Dr. Omer Awan. He's a physician as well as a healthcare contributor at Forbes.com. Doctor, thanks for joining us tonight. Let's start where our correspondent left off. We all know that vaccination rates are low for the season across the country. In fact, the CDC conducted a survey to find out among those eligible how many of them intended to get vaccinated. And for the week ending December 23rd, 39% say they probably or definitely would not be getting the COVID vaccine. 30% said the same about the flu and RSV shots. What's going on here? Can you call it vaccine fatigue, or is there a little more to it?
I think it's a combination of both, Chris. I mean, I think, first of all, there's a lot of fatigue given the fact that, COVID occurred 4 years ago and people got the initial shot, but now people are somewhat reluctant, or there has been some vaccine hesitancy amongst the general public. And, quite frankly, there's a lot of misinformation out there. Many Americans believe that vaccines can cause harm. Many feel that their children can get autism from vaccines. And we, of course, know that's not true. Vaccines are overall very safe. They're the best line of defense to prevent severe illness, hospitalization, and death. And we know, globally, vaccines have saved millions of lives. So certainly it's not too late to get the vaccine. If you're eligible to get the COVID vaccine and the RSV vaccine, please go ahead and do so to prevent severe illness and potentially going to the hospital.
And with all these viruses going on, would now be a good time to start masking up again?
I think, masks add an extra layer of protection, so, particularly if you're going into high populated areas, if you are going to be around those that are high risk for infection, masks allow you to protect yourself and, more importantly, protect others that can't protect themselves. So those who are immunocompromised, meaning those, who have cancer, those who are on steroid therapy, those who are recipients of organ transplants, they often have a weakened immune system. And by wearing a mask, you're actually protecting them from potentially getting infected. So masks just add another layer of protection against the virus.
Yeah, a good perspective there. Doctor, what are the main differences between the flu and COVID? I know we've talked about this before in recent years, but, we want to talk about that again, just to give folks a reminder. And are at-home flu tests easy to come by these days?
So they're actually very similar, Chris. I mean, the symptoms are, fever, cough, runny nose, sore throat. There can be some variability in the symptoms. So, for example, sometimes COVID can result in loss of taste, but really they present very similarly. And that's why it's so important to get tested, because, RSV, flu, and COVID all present very similarly. So, we often don't know, and physicians don't know what a patient has unless they get tested. So very important to get tested. The Biden administration has allowed for 4 free COVID tests per family. So relatively easy to get. The flu testing can be a little bit more challenging, but certainly, most healthcare facilities have it. But the bottom line is that if you have any of these symptoms, especially now when respiratory illnesses are surging, very important to get tested.
And when it comes to treatments, we've heard of Tamiflu for the flu and Paxlovid for COVID. Are these still the 2 main medications that people could be, reaching for if they need it?
They are the main therapies, definitely, especially if you have recent infection. Very important to take these medications within 5 to 7 days of symptom onset. So, Paxlovid and certainly Tamiflu can help prevent severe infection and prevent you from going to the hospital. Now, you still are going to have the infection and you still may show symptoms, but certainly it can decrease or tame the level of symptoms that you have. So certainly very important, particularly in those who are most vulnerable.
And hospital data shows that those 65 and up are being admitted for flu and COVID at higher rates than any other age group. It's the same thing for young kids under the age of 4 being admitted for RSV. Break that down for us. Why is that happening?
Well, those, Chris, are the ones that are the most vulnerable to get infected. Kids often have weakened immune systems to begin with. It takes time, remember, to develop your immune system, to be exposed to certain viruses and pathogens so that eventually your immune system develops further. And those that are older often have chronic conditions. Remember, things like lung disease, heart disease. They may have a history of cancer. They may be immunosuppressed, meaning their immune system weakens with time. So those patients are going to be most vulnerable to get infected. And that's why we see, many of these people ending up in the hospital. So remember that if you're in the prime of your age, in your 30s and 40s, you often don't have a weakened immune system. And that's why, we're seeing less of those type of patients in the hospital. But certainly possible for all age groups to develop COVID, the flu, RSV, and certainly, hospitalization can happen in all age groups.
Lots of great information tonight. Dr. Omer Awan, thanks so much for joining us. We appreciate it. And Happy New Year to you.
Happy New Year to you, Chris. Thanks for having me.
All right, we'll see you soon. So to come.